Good afternoon, everybody. I'm Dr. Heather Denniston. With me today is Mary Brown from SMJ Consulting in Seattle. Welcome, Mary.
Hi, thank you for having me.
So excited to have you. This is a topic that I have only recently come to even have any sort of glossing of understanding. And so I am so happy that you agreed to be with us today. We are going to be talking about cannabis, CBD oil, medical use, history, where you get stuff, how it affects you. We're going to cover all sorts of ground here today, and such a worthy topic. Hi, Cynthia. Welcome. And I know as soon as I posted that I was going to be talking about this, Mary, everybody was like, oh my gosh, that's the best subject ever. So I'm very, very pleased that you are ready to go. So thank you for joining us.
Oh, absolutely. I really think it's time for the public to understand and get a little bit more education on the topic. So I'm happy to be here. Thank you again for inviting me.
Yeah, yes, it is, for sure. Now, before we get any further, we're going to do just a quick thank you to our sponsor, The Change Cave. The Change Cave is an online learning institute for women over 40 who are ready to up their wellness game. It's 12 modules, weekly newscasts, live mindset classes, and such a kick-ass community of women all working together on their own personal goals while supporting each other. I will put a link down below. Hey, Jessamine, I will put a link down below for The Change Cave. If you are a woman over 40 and you are ready to take your wellness to that next step, that is where you want to go. Linda, great to see you. North Carolina, fantastic. So we are talking to Miss Mary Brown from SMJ Consulting, and we are going to be talking about cannabis. So Mary, what gives you all the credibility to talk about cannabis? Can you tell me a little bit about your background and what brought you to where you are today?
Absolutely. So the first thing I want to say is, first and foremost, there are no experts in cannabis education. It is such an emerging topic that everybody really needs to stay up to date on the research, and that really is our goal in the education that we do in working with patients. For me personally, I started researching cannabinoid therapy about 10 years ago. Believe it or not, I was actually an elementary school teacher, and I was had earned my principal certification and was looking into a PhD, and I wanted to know about the impacts of pharmaceuticals on federal funding in the classroom. So if there were parents that were addicted to opioids or children that were being overprescribed medications, what type of alternative medications might be able to supplement and not have such a drastic impact on the classroom. So being in Washington State, we were very fortunate to be on the forefront of cannabis as medicinal product. So I was able to really connect with some medical practitioners around here and focused my PhD studies on cannabis. At that time, there was no degree you could earn in cannabinoid therapy. So it was just more of a personal quest. And here we are 10 years later, having the opportunity to now educate what we have worked on with the medical practitioners, the one-on-one patient advocacy, as well as following the trends in patient response to different types of products.
That's fantastic. So tell me, SMJ Consulting, is that your baby? Is that something that you collaborated with a partner?
So SMJ Consulting was my original business, and we are now located in the Ames Institute, which is the Advanced Integrative Medicine and Science Institute of Seattle. We have Dr. Sunil Agrawal here, Dr. Leanna Standish. And so this is kind of something that's really just evolved. There have definitely been partners along the way. Right now, I work very closely with my lead consultant, Jessica Strufert, who was an RRT. And for those who don't understand what that is a respiratory care practitioner. So she was in the hospital for 21 years, and she really saw different impacts of pharmaceuticals on various different conditions. And so she has now since stepped out of the hospital to work very closely with me. We look at contraindications of medicine and cannabinoids, which molecule from the plant might be better for patient aside from just THC and CBD, and we'll talk about that a little bit more as we move forward. So so it's definitely a team effort.
That's great. So there's so much confusion around this topic, and I only started being a CBD user within this year. And when I went to kind of learn about it, oh my goodness, it was overwhelming. There was lots of misinformation out there. THC, CBD, hemp, marijuana, all these words that I just didn't really understood. So can we just do a little sort of definition lesson here for a moment and just quickly go through some of the key verbiage that we need to know? So cannabis is the plant, correct?
Exactly. Yes.
And then my understanding is that there are different strains of that genus.
Mm-hmm. That's correct.
Oh, this is like a quiz, Mary. Okay, ready? So the strains of the cannabis plant are sativa, something else, and something else.
Okay, so I'm going to stop you right there. Okay, you're on a good path. Right? No, that's okay. You're on a good path. So cannabis sativa is the general species of what we consider marijuana. Okay, and I will always call it cannabis because marijuana is actually the pejorative term. It was something that was really put out there during the reefer madness era, and it was of Mexican descent, and that is something that, you know, was really, it's a derogatory term. So we always say cannabis when you're looking scientifically. Okay, and that's good note if anybody's researching anything. You should really look up cannabis instead of marijuana. Okay, so first and foremost, you have the cannabis sativa is the species of plant. And originally, when the plants kind of really became relevant, they subdivided them into two categories. You have sativa, which initially was known to be more energizing and kind of give you a boost if you needed it. Then you had indica, which in cannabis terms, they would say indica couch lock. It really kind of made you tired and, you know, a little more lethargic. Now, even though those two categories are often discussed, we really don't place much weight on that anymore because of the influx of different producers and processors. It's really easy to make a new species of cannabis plant because technically it is a weed, and you can combine two cultivars to make a new cultivar. So in Washington State, you go into the stores and they do have them divided into sativa and indica, but you know, it's really becoming more necessary to look at the overall components of the actual plant instead of those two categories. So you are right, but things are changing.
Okay, so let's just quickly go through a couple of their definitions and let's get into it, because I know I've already been asked some key questions here. I know some people are going to be asking questions in the comments. So I can't even say it. Endocannabinoid system.
Endocannabinoid system.
Thank you.
Yes.
Tell me,
You're
what
close.
is that? Because look, I'm a doctor. I did some anatomy, and never in all of my neuropathophysiology or anything did we talk about those receptors. And so talk to me a little bit about this, because this is, for those of you that are listening, stick with us here because you have to understand this in order to understand why CBD has the incredible, powerful effects, or cannabis has the incredible, powerful effects that we're going to be talking about. So can you explain that for me, Mary?
I sure can. So our endocannabinoid system, one of the reasons why a lot of medical practitioners have not heard of it is it was just recently discovered in the late 80s, early 90s. And so upon discovery, there has, up until recently, there has not been a lot of literature accessible to practitioners about our endocannabinoid system. And there are still many, many unanswered questions. So in short, our endocannabinoid system was discovered when doctors were tasked with the task basically of finding the negative impacts of cannabis in the human system. And what they discovered is that we have receptors throughout our body that have a direct interaction with compounds of this plant. Okay, so they divided those into two categories. They identified we have what are called CB1 receptors in our brain. They have a special affinity to certain parts of the plant, especially THC. Now, mind you, I'm broad stroking this. I'm very technical about it. We also have other receptors throughout our peripheral system. So that's our blood, our organs, our tissues, and they have a special affinity for CBD. So when people say, I've tried a cannabis product and for my headache, but gosh, my joints felt better, that's because parts of this plant are interacting with different molecules on our cells that trigger our own personal response to mood, digestion, sleep, appetite. So it really can have an impactful presence in our body and overall health and wellness.
Okay, excellent. So that's very helpful as a start. And so I want to make sure we're going in order here. So I am looking, I know what I was going to ask. So when I started toying with some CBD for my own personal arthritic and anxiety conditions, I still felt, it's been legal in Washington for some time, but I still felt a little sheepish walking into that dispensary. And I'm kind of like looking down and I'm like, what? This is stupid. Why am I feeling this way? But I know I'm not alone. So can we talk a little bit about the stigma and about, you and I joked in our pre-chat about moms driving their kids to school and being anxious about the fact that they've taken CBD oil and should they be driving. So let's just knock some of that, kind of the stigma and the idea about the high versus the non-high. Can we pull that apart?
Of course, of course. So first of all, to address just the issues, the hesitations you have going into the stores, I think it's unfortunate because in Washington state specifically, there used to be medical dispensaries. But when the voters voted for cannabis to become legal, everything shifted to recreational. And so there really was marketing towards the recreational market. And the state did not allow any medicinal marketing. So it's automatically assumed from true patients, if they have to get their products from a recreational store, I think that's where that feeling of uncomfortableness comes in. And you're correct. I mean, we've had women call us and say, I'm not going to go to a store in my neighborhood. I'd rather drive an hour away. But the funny thing is when you walk into those stores, more than likely you're going to see your peers there. Because for two things, cannabis is not cheap. And so, it's a different caliber of people purchasing now. So just understand when you go in the stores, everybody else is in there for the same reason. Yeah. And, and they're probably not looking at you in a negative connotation at all. But that being said, so to address the stigma of using cannabis, and quite honestly, whether it's for recreational purposes, we have no problem posting all over Facebook that, oh my gosh, I needed my 4 o'clock glass of wine to relax and deal with my kids, right? If you're using cannabis for medicinal purposes, it's very different. Okay. Yeah. Even recreational, personally, I'm fine with it because there is no hangover. There's a lot of benefits to cannabis over alcohol for medicinal or for recreational purposes. But in terms of medicinal, we use medicine all the time and function daily. And I think, understanding the medical aspects about how cannabis works in your system, it is okay even to take a small amount of THC. And you can do that and not be cognitively impaired. It can have a medicinal value. There's a lot of people that are choosing cannabinoids over their opioids. And, if they have to take their Xanax before hopping in a car, they're just fine with that. CBD can have that same impact without any negative connotation. So understanding your dose and understanding your personal relationship with cannabis is something that's very important.
Yeah, and I think, like you said, there's no experts, and so there certainly are a lot of really non-experts right now, including myself, who have just had to kind of slowly educate myself a little bit at a time. And it has been incredibly powerful, the benefit I've had from it. And so I think we should just segue into that, Mary. I should just say exactly what you do. We call you, we set up an appointment with you, and you go through our health history and help us determine what kind of the right line of approach is in regard to using cannabis. Is that a fair statement?
That is absolutely a fair statement. So one thing I want to be very careful to disclose is that I'm not a doctor. I do research, I do education, and we educate the doctors and we educate the patients on what cannabinoids can do for them specifically based on current research. And so that's the benefit of us being in the Ames Institute with our clinic. If patients want to see an MD or a naturopath that can verify what we are doing, we are all under one roof. Okay. So, but we also work very closely with different practices in the Washington state area, as well as nationally, because we do a lot of phone consultations. So patients will come to us, let's say, for example, breast cancer. There are certain types of breast cancer that research is now showing high THC is not a positive treatment. CBD would be better for these breast cancers. Now, that's not widely known to the public, and because we are staying up to date on the research, we can talk to them about what they are currently taking, what is or is not working, and then we also give them information based on what's already known about how it can counteract different medications you're taking. So, for example, if you're on high steroids, your THC absorption is not going to be as high. So we can give recommended dosages based on patient response, what is and is not working. And then we connect with industry members throughout the United States, because it's important to, with the lack of regulation, some products are not as clean as they might purport to be. And I will not talk negatively about any product, but there's a lot of products that used to have a positive reputation, and they are all over the United States, and maybe the quality has changed. So we try to stay up to speed on what's happening. And, you know, a certain type of product might be fine for patient A, but patient B needs something entirely different based on their lifestyle choices, their access. So that's really what we try to keep our fingers on the pulse of everything that's happening.
I think that's such a good point. I educated a lot of people about fish oil, and how when fish oil became well studied, all of a sudden everybody and their dog was making fish oil, and the quality went down, full of heavy metals, already rancid upon delivery, and there were no regulations. And I imagine the same is true for cannabis products. It's not like it's being run through the FDA or any kind of, in most cases. Now, medicinal quality CBD oils and that sort of thing, are they run through more stringent testing?
No, not necessarily. And that's the problem, is a lot of the regulations, and it varies by state. So there you have discrepancies. But that's kind of the unfortunate issue. Take, for example, what's going on right now with the vape crisis, we call it. So people are vaping nicotine, people are vaping cannabis, and they can't figure out what is making people sick. A lot of it is, if it is in the cannabis industry, because again, they've not been able to pinpoint anything, is companies that are purchasing their cartridges from out of the country that might not be a clean cartridge. So there's a potential that it's not even the product itself, it's the cartridges being used. So, you know, you really have to kind of understand all the nuances that go into different cannabis products.
Yeah. So let's say we'll use me as an example. I've got some arthritic issues, I have some anxiety issues, and may I just emphasize the fact that you said you do work remotely. So anybody who's listening, know that you can call SMJ Consulting and you can do a Zoom call with Mary or one of her counterparts, and you can get such a better, clearer direction on how you want to move forward with your own cannabis use. But let's say I'm kind of just like, I didn't know about you. So you walk into a dispensary. What are some just practical things that I need to know going in, and what do I ask for?
Okay, that's a really great question. So the first thing to consider is mode of administration. Okay, you have the inhaled mode of administration. Often if people are looking to combat anxiety, they will say, gosh, I went through a day of work and I'm able to get a vape cartridge, or I'm able to get flour and I'm able to inhale that. Okay, that is okay for personal choice as long as you're using a clean product, but that's kind of a Band-Aid fix. Okay. Now the products that are available that come in tincture form, which is under the tongue, or something in capsule form, can be a little longer lasting for patients. And so we want patients to understand that a really high quality CBD product that can be taken during the day may mitigate the need for, that ultimate relaxation at the end of the night. Yeah. So if we look at dosages, okay, the first thing is if you're using a high CBD, again, good quality, and we can talk about what that really means in a CBD oil, you want that to be USA sourced, okay? You want to make sure there's no additives. A really quality CBD product does not have to have flavorings. We have one company that we often refer to, Revita Labs, and I can talk about that later. But the reason why we like this company is it's flavorless and it's very, very high concentration, okay? Because you want to take a small amount for greater effect. If you're walking into a dispensary, primarily everything you're going to find in there has 5 milligrams of THC or above. So that's the other thing. You'll often hear the ratio 1-to-1. And what that means is that it's a balanced amount of CBD and THC. Okay. So it's important to look at any type of labels beyond a ratio and see the actual milligram dosages. A typical person for general anxiety probably does not need more than 25 milligrams of CBD per dose. Okay. But you could dose that a couple times during the day.
Okay. That's super helpful. So,
so we talk about
milligrams per dose, maybe 2 doses per day. So when you and I started talking, I still hadn't really decided on a source for myself. I have been using a product, but we talked about Rividel. How do I say it?
So can I show it on here? I have it here.
Please.
We use it in our clinic. Okay.
Yeah, I had it.
So this is Revita Labs.
Okay.
Revita, like revitalize.
Yeah, so we talked about that, and I was in communication with them because I was like, awesome, like a super clean source. And so I got their 1500 product, says 1500 on it. So,
Okay.
so how do I know? I guess the milligram dose is on like the serving.
Yes, and that's really, really important to notice is that you have a lot of people think if the dose on the bottle might be per serving, that's usually not the case. So for example, this is 3,000 milligrams for the entire bottle. So this is a 30 milliliter bottle, 1 dropper full is 100 milligrams. Okay. And I want to be clear, the 25 milligrams per dose, you know, that is something that varies person to person, but that's a good baseline. And that's on a product that really doesn't have a high THC. Okay. So always look at the initial label and then look at the dosing on the back. And again, check your ingredients. Okay. MCT oil is very common in CBD tinctures. What often works better is full hemp oil. Just because of the way it interacts with the human system. Water soluble might work rapidly, but it really doesn't have a longer lasting healing effect. So those are little kind of tips and tricks.
Okay, two quick, one statement, one question. Statement is, people, THC is what makes you high. Am I right, Mary?
That is true, yes.
So the more THC in your product, the more likely you are to have
the higher you're going to get. Yes. Psychotropic activity.
And that's when you don't want to drive your kids to school. Okay.
That's correct. That is correct.
Number two, there's all sorts of discussion out there about menopause and CBD and sleep. Here's my question. Is it cumulative? Meaning, do you have to take it for a certain amount of time and then it affects? Do you just take it as needed? What's your recommendation when you're dealing with a perimenopausal or a menopausal woman? And we've got some great questions coming up in the comments, I will tell you. So we want to make sure we get to those. But me first. What's your recommendation about all that? Because I've heard both ways. It takes 21 days to light up the receptors and blah, blah, blah. So what is it?
Yeah. So from our experience, and according to what research shows, is that it really should not take longer than a couple of days for your body to respond. And in most cases, it's pretty instant when you find that dose. The 21-day time frame is usually to give people the opportunity to increase their dose as needed, because we're all different as individuals. That's the beauty of cannabinoids versus pharmaceuticals. There is no set dose. You really have to look at what works for everyone. So when you find your, we'll call it the sweet spot, you should have a response almost immediately. Now, anything hormone driven should rely more heavily on the CBD side. Again, we don't have time to get into it today, but hormone sensitive cancers like prostate cancer, breast cancers, pre and perimenopausal, those are all things that respond better to CBD than THC. Now, that's not to say that you don't need a little bit of THC in there. I give the analogy like exercise. You would never just run the same hill or exercise one muscle in your body. You want to exercise everything. And with cannabinoids, by using both THC and CBD, as well as other cannabinoids, if you have access to them, you're hitting all the targets on your cell, so you're going to get a more rapid response at a lower dose.
Okay. And is CBD an investment in future health? Meaning, is there science there to talk about longevity and anti-cancer and all of that?
Absolutely. And again, you know, in the interest of time, it's really difficult to get into that. But more and more studies are showing that cannabinoids have anti-tumoral properties or anti-proliferative properties. Again, we have the benefit of working with patients, pre-scans and noticing that when they're adding cannabinoids into their protocol, their scans often turn out better. It must be real. There's no miracle cure. Right? It doesn't exist. It's not out there. But the more and more research is showing that cannabinoids can greatly impact longevity, whether you've been pre-diagnosed or, it just runs in your family, or for general health and wellness. We all keep Tylenol on our shelves. Here's something I've had people say.
Some of us don't, Mary.
Yeah, well, okay, so that's kind of, I don't either. And that's what
you're talking to a chiropractor, Mary. Anti-drug.
When I say all of us, thank you for that correction.
I know.
Because we're the same way, People will say, it seems like this is covering everything, and I don't believe it. A majority of the population of the United States relies so heavily on Tylenol and Neosporin, kind of the cure-all for everything, and it's not the case, and it has negative impacts.
Yes.
But what we know about whole plant-based products is that they really can, work in the same way as these pharmaceuticals without the negative side effects. So taking them almost as a daily vitamin,
yes,
within the appropriate dose, can certainly be restorative and reparative in terms of a cellular level. It's also being noted that it can potentially stop the buildup of plaque on the brain that contributes to Alzheimer's. So, and again, we get to see that response in our patients post-stroke, post-traumatic brain injury.
yeah.
And in many cases, it truly is almost instantaneous. Autism, nonverbal, when they start to use these products, they have a more of an opportunity to, react to the stimulus around them more appropriately.
So just because someone out there is going to ask it, you're suggesting CBD, really, most of the population should be at least have it on their shelf, if not be taking it like a multivitamin. So somebody's going to be out there asking, well, how do I know if I'm taking too much and what are the negatives? Is there too much? What happens?
Right. Well, I think there's always too much of everything, right? Even in exercise, you have to everything in moderation. And a lot of the dose is really based on personal preference and monitoring, your function. Because yes, if you take too much CBD, for some people, it can make you very tired and fatigued, but at just the right dose, it can give you that energy to get out and do more. And primarily that's what the patient response is showing us. However, everybody has their own limit. And it's the same with THC. Because of our genetic makeup, some people respond very differently to THC. I've had people replace all of their opioids and still be high functioning on various levels of THC. Same thing with anti-anxiety medications. We all know we're overprescribed anti-inflammatories. This is something that once you start taking cannabinoids, it can trigger chemical reaction in your body that actually allows your body to produce its own natural chemicals. So to go back to your question about it being cumulative, yes, often some patients need more up front, and then they can back off a little bit because it gives that body its own response to start acting as it was naturally intended to.
Okay, I love that. Let's go to a couple questions. There's some good ones. Let's see. Where do I even want to start? Okay. So Cynthia asks, she heard that medical cannabis producers use a lot of pesticides in order to get probably a big crop yield. Do you have any information on that at all?
So the way you can find out whether they are pesticide, herbicide free is really going on their website and asking for test results. Again, I talked about Revita Labs. This is verified, organic, vegan, gluten-free, herbicide, pesticide-free. There's a lot of great companies out there that's doing your due diligence and finding you should be able to have a batch number associated with everything that you purchase. Again, it depends on what state you're in. In Washington State, they have to name the pesticides and herbicides that they use. So it's very important. There are 3 companies in Washington that we most trust. One is Trailblazing, the other is Washington Bud Company, and the other is Puffin. And they are all natural cannabis companies. So that means they use bugs to take care of other bugs instead of pesticides.
So the company that we first mentioned at the beginning, can you hold that up again for me?
Sure.
And so
this is what we use in our clinic.
Okay, got it. So that's what you use in your clinic. And so if we called Revita Labs and said, what pesticides do you use? Would they produce a list, or would they say we don't use any pesticides?
So they would say you can look at all of our test results online, and they verify pesticide, herbicide free, mycotoxin free. Everything is available. Okay. So yes, they are organic. Mm-hmm.
Here's another question from Hillary.
Yes.
She's sorry. Go.
That's okay. Anybody can say it, right? That's there is no defined organic certification in cannabis or hemp. So that's my point is exactly everybody can say it if they want to say it, but really look for those test results.
Okay. Yeah, that's great. Hillary asks, are there any benefits for depression I think Hillary is an academic by nature, so I'm sure she's asking, are there many studies that have been done on cannabis and depression?
So there are various studies that are done, and I encourage anyone here, you can either contact us and we can supply those for you. Okay. But look at the National Institute of Health, PubMed, British Journal of Pharmacology and look at cannabinoids for depression. And what is often found is that, again, it is more about CBD and THC. There's some other great terpenes in the cannabis plant, and depending on where you're sourcing from, if you're in a legal state or not, that's more of the whole plant products.
Hey, Mary, you're throwing out new lingo near the end of the show. What the heck is a terpene?
So a terpene is the essential oils that pre-exist in nature as well as in the cannabis plant. So for example, because we're talking about depression, linalool is the oil that is derived from lavender. Okay. In different cannabis strains, you will find high amounts of linalool that is very, really good for anti-anxiety. That's what makes the cannabis plant so special. It actually contains a host of oils that you find in nature already, like in we all put lemons in our water, right? Yeah. There's limonene. There's also strains that are very high in limonene that can give you an energy boost. So again, we could go on for hours. And sorry about the new terminology, but it's one that people are hearing quite often.
Yeah, I'm giving you such a hard time. Cynthia asks, so is it different strains or different levels of CBD/THC that vary in effectiveness? I think I'll start. I was going to say it's both, isn't it? So it's and so would you talk about rotating then, I guess, with that question?
Absolutely. So, and again, that's really up to the individual. Some people find their product that they like and it works perfectly. But if we think about it as humans in nature, our bodies change, the environment changes, what we do changes. And so, and because cannabinoids have such a strong cellular interaction in the human system, you need to take all of those variables into account. So yes, varying your dose, even the time of day, can have a different impact. There's a lot of people that use CBD for sleep, but it's really a 50-50 chance on whether CBD is going to make you tired or give you an energy boost. So, if you take it and it makes you tired, use that at nighttime because, again, it does have those cumulative, reparative, restorative components to it. And mind you, we're just talking about CBD and THC. There's over 300 other cannabinoids that are very beneficial medicinally. And so that's the other thing is when you're choosing a CBD product, you've heard the words full spectrum or broad spectrum. Yeah. You want to make sure, again, that you look at test results because a high quality CBD, even on the open market, can have minuscule amounts of THC, CBG, which is a new one to many people, cannabigerol, CBC, cannabichromene. And here's another analogy. You could use CBD or CBD and THC only, but that's like bringing two generals to the battle. If you're in a battle, if you use the full spectrum, it's like bringing the entire army. So, and for patients, it's really beneficial because it's less impactful. Higher CBD mitigates any psychotropic effects of THC. So if you're looking for that elevated nature of THC, you don't want to add CBD in there. If you want more of a balanced response, definitely CBD.
And so let's just recap on that because that's new information to me. So when we're looking, actually a broad spectrum or full spectrum is an excellent choice because it, like you said, it's bringing all of the other cannabinoids. You'll get it. And so that's something that we want to look for. Yes.
Yes. And again, with the lack of regulation, people think that it is very regulated, but it's really not. So don't go, I'm going to pull up this bottle again. This says full spectrum. Okay. Yes. Look at the test results because you want full spectrum cannabis hemp. If you get full spectrum regular hemp, you're going to have all CBD. And yes, it is full, it's extracted from the hemp plant, but it's not going to have any of those other cannabinoids. So that might be good, just a quick to give a differentiation between cannabis-derived CBD and hemp-derived CBD. Would that be helpful? Okay.
Please do. Yes.
So by definition, when cannabis was actually the primary ingredient on the shelves in our pharmaceuticals up until 1937. And it was an act of the government to make it illegal for various political reasons. And so when they did that, the only thing that they chose to define as cannabis was the plant material with the level of THC. Okay. Now, through the years, because of different legal changes and the ability for people to grow and mix these strains, that law has stayed the same. So hemp is one variety of the cannabis species, and that only contains CBD. That's it. So if you pull oil from the hemp plant, all you're getting is CBD.
Okay.
If you have cannabis-derived CBD, again, hemp and cannabis are like siblings. But when you pull that CBD, you're also going to get a host of those other ingredients or cannabinoids, like I mentioned, THC, CBC, CBG. Those are all going to come with it, just in lesser amounts. So that's what you want.
Can I just restate? So you're saying when on the bottle it says hemp-derived CBD versus cannabis-derived CBD, hemp-derived CBD is going to be just all CBD, right?
I'm going to throw a kink in it right now.
Okay.
So technically that's correct. However, by law, if it's less than 0.3% THC, companies can call it hemp and sell it legally on the open market.
Okay.
So it's really confusing for consumers. And in all honesty, it's not fair. It's really not fair, because you can go on Amazon and find a $20 bottle of full spectrum hemp, and it's going to be 3,000 milligrams, but then you find another bottle that is the same thing but might be 10 times higher in price. So it's really important to look. Don't go by the word hemp. Make sure though that you look at full spectrum or broad spectrum. Look for test results that actually show there's a small amount of some of these other cannabinoids in there. If they can't provide you test results, it's not a product you want.
Yeah. And I think that the nice thing about, because I was on the Revita Labs website yesterday, and they've got lots of resources and information there, and it should be fairly easily accessible, I'm assuming, yeah?
Oh, yes, right on there. You just, you can hit test results, and then if you have a bottle, batch number, and again, any of these companies should do this for patients. And we like them because they're smaller. There's a lot of other companies that are very large and have gone, mass production. You lose quality control when you do the mass production. So you want your public benefit company, and they do offer money back if the product doesn't work, which is another key in good companies. Yeah.
That's great. Cynthia asks, is it different benefits if you're ingesting topical or smoking? Can you just talk a little bit about distribution channels?
Yes, I can.
Okay. By the way, Mary, I have to commend you. We've gone completely off script for the whole show, and you have you've just run with it. So thank you. I don't even know.
Thank you for letting me run with it.
I think that these are good, and we're getting some great questions in the comments. So let's talk about distribution channels, and then we'll get maybe to one more question, and then we'll wrap it up, okay?
Sure. So distribution channels, that goes back to the modes of administration. So when you're inhaling cannabis product, you are basically igniting the THC or activating it and the CBD. That's going to be rapid response, but it's not going to last very long. So typically, and we know this because we actually did a Harvard study here at the clinic with inhaled cannabis. Your peak is about an hour into it, but then you're back to baseline about 2 hours later. So if you're relying on inhalation for pain, it's going to be rapid relief, but you're going to need to use it more frequently. Now, sublingual, that means under the tongue, is a very rapid distribution to the system because it goes through your mucosal membranes, which are very thin in your body, and it is a rapid distribution. So typically you get a positive response at probably within 5 to 10 minutes, whereas inhaling is almost immediate. And then you have oral, which would mean in capsule form or edible form. And yes, they do have very high CBDs in edibles. We're not really talking about your neighbor's brownies, but so that has to go through your first pass metabolism. So what that means is it's going to take longer to impact you, but the effects may last a little longer. So for example, if someone is having trouble sleeping, we might suggest that they use a sublingual method for that rapid relief, but then they follow it with an oral, because by the time it hits the rest of your system, that can keep you asleep, right? So again, and that's the problem with a lot of consumer use. If they have pain or anxiety or even cancer, they may say, well, I tried a little bit every day after work and it really didn't do anything. It's about purposeful dosing, and that's kind of our key phrase, is purposeful dosing, and you might need different products to really meet your needs. But again, whenever you take cannabinoids, based on research, it's reparative, restorative. You're not doing the negative damage to your body that other pharmaceuticals are doing.
Yeah.
And they can make pharmaceuticals work a little better. So often when our patients are using it with certain types of opioids, they don't need that drastic increase. They can stay where they're at and many times titrate off of them.
That's excellent. That's great. Okay, I think there's one more question up higher. Oh, this is one that that gets asked, and so the question is, what are the tests or consequences for CBD use and driving? Is there, to my understanding, there is no legality with that, at least in Washington State.
Right.
Is that true?
First of all, let's talk about Washington State, where you're getting your CBD from. If you are getting your CBD that does have THC in it, let's say you're a Metro bus driver or a federal employee, you will test positive. So understand what CBD you are taking, but you would test positive for THC if there's THC in it. Now, you can get THC-free CBD products.
Yeah.
Sometimes you might need a higher dose of those for them to work as effectively, but that's something that you can do. I want to throw out there's something called the Druid app, D-R-U-I-D.
Okay.
And it was built by a Harvard professor. And you upload it on your phone, it's $1. And you can take a little test before you take any cannabinoids, and then you can use it later on and it measures your level of impairment. So if you're ever just wondering, would I be pulled over for some type of impairment level based on your cognitive function, this is an amazing test to use. And it's being, widely accepted in different fields, who test for these things.
So Druid app, I just put it up there in the notes just in case anybody wants to look at that. And then, okay, that got answered. Oh, some great questions in here. Okay, so I'm going to just throw this up too, just because we've been talking about Rividol.
No, it's actually Revida.
Oh, no L on the end of that.
No L. Yep. No, just Revida.
Yeah, I thought it was because I learned to say it by about halfway through the show, and then I saw the spelling of it.
I actually see on your banner it's spelled wrong.
Yes, and that's what I'm saying. Yeah, so drop the L, people.
Drop the L, yeah.
But if you go to Rivida Labs and when you're checking out, use the code WellFit, all caps, WellFit, and you'll get a 10% discount. Because the good stuff is a little pricier, but you gotta be careful about what you're putting in your body, people. We know that, we teach that, and so that's very, very important. So,
and I'll tell you, it's also this and other products. If they are not cut with cutting agents, they're going to work better for you, and you don't need as much of them.
Yeah.
So kind of think about that. Yeah.
Yeah, and that's something we teach when we're talking about pharmaceutical grade supplements. Just buy the better stuff and take a little less of it, and it's much better than getting something that you just don't even know what's in there. And
and again, we chose this is not the only product. There's a lot of great products, but our clinic, because we are a research clinic and we want to make sure that we can match any type of results with a standard product, and safety for pediatrics. We do a lot of pediatric dosing. We need to know that it is 100% clean, and that's why we choose to work with them.
Yeah, that's great. And as you said, this is not a sales pitch for them, but this is just
not at all. No,
everybody's asking. Yeah, everybody's like, where do I get it? And that's one source that you can use if you so choose. One final question from one of the audience members, and that is, how long? So you're talking about testing positive THC, blah blah blah. How long is it in your system?
So for tests, THC usually stays around 2 weeks. Again, there is no blanket answer for that. So I highly encourage people. But that being said, if you are doing a THC-free CBD product, nothing should come up. But you really want to know what you're taking. And that's where, we can work with patients one-on-one, to really look at the product. So that's the first thing we do when patients come to us. We say, what do you have access to and what are you using? Let's see if this could impact you in a negative way. And, there may be other products, that don't.
I think that's great. So, Mary from SMJ Consulting in Seattle, people can reach you by going to your website, and they can consult with you via Zoom call if they so choose.
Absolutely. We
Okay.
welcome it. We really enjoy working with
Yeah.
every patient, whether it's cancer to anxiety. You truly can do cannabinoids.
Or even just longevity, wellness, you know, all of those things. And I'll tell you, after everything that we covered today, we need people like you, and we need more people like you who can educate us and help us be kind of turned into the right direction of what to choose for ourselves and our families. So thank you so much. I really appreciate
you for having us.
Here. Oh,
really appreciate being able to give the education.
Oh, this was a great show. So thank you so much. I know people will be following up in the comments. So Mary, if you will check back there, you know, later today, I know people will probably want some links and stuff. So we'll keep an eye on that. And guys, share this out because these questions are not unique. These are questions that lots of people are wanting answered. And this is a nice, safe place for them to learn about it. And so please share it to your friends and family. And guys, we'll see you next Friday on the Well Fit and Fed show at noon PST on the Well Fit and Fed Facebook page. And Mary, I'm sure we'll have you back sometime because this was just such quality information. I do appreciate you taking your time. So thank you.
Thank you very much. Again, we appreciate it. And any questions are welcome. Thank you.
Wonderful.
We love what you do.
Oh, thank you. All right, everybody. We'll see you next week. Mary, stay on for a minute and we will check back with you guys all later. Have a great weekend.